Welcome to Future Sight. In this episode, we focus on one of the most impactful innovations in modern care delivery, remote patient monitoring, often referred to as RPM. This technology is transforming how healthcare professionals support patients outside the clinic or hospital, particularly those managing chronic conditions. Today, we will explore what RPM is, when and why it gained traction, how organizations can implement it effectively, and a real world example that shows its life saving potential. Remote patient monitoring involves the use of connected digital devices to collect and transmit patient health data from their home to their healthcare provider. These devices include blood pressure monitors, pulse oximeters, weight scales, glucose meters, and smartwatches. By capturing vital signs in real time and transmitting that information securely to care teams, RPM enables providers to track health trends, detect warning signs early, and adjust treatment plans before a patient ends up in the emergency room. Although RPM has been in development for years, it was during the global health crisis of 2020 that many healthcare systems adopted it more widely. The need to reduce in-person visits and manage hospital capacity pushed organizations to think creatively. RPM became a way to monitor patients without bringing them into facilities that were often overwhelmed or unsafe due to infection risk. It quickly evolved from a convenience to a critical component of care, especially for high risk and post discharge patients. The value of RPM lies in its ability to shift care from reactive to proactive. Traditionally, providers might only know a patient's condition had worsened after symptoms led to a hospital visit. With RPM, care teams can monitor patients daily and receive alerts when readings fall outside normal ranges. This allows them to intervene early, sometimes before the patient even realizes something is wrong. This approach not only improves outcomes, but also helps avoid expensive hospital stays. Consider a patient with heart failure. One of the early signs of decompensation is sudden weight gain due to fluid retention. With a connected weight scale at home, this change can be detected immediately, prompting the care team to adjust medication and prevent hospitalization. The same is true for patients managing diabetes, hypertension, or chronic obstructive pulmonary disease. By staying connected to their care team from home, these patients receive better support and their providers gain more insight into how they are doing day to day. A compelling example comes from a rural clinic in North Carolina. This clinic serves a community with limited access to specialty care and long travels to the nearest hospital. They launched an RPM program for patients with heart failure, equipping them with Bluetooth-enabled weight scales and blood pressure monitors. The clinic's care team monitored the data using a secure dashboard that was integrated with the patient's electronic health records. If the system flagged concerning trends, a nurse or physician would contact the patient and intervene quickly. The results were impressive. Within 6 months of launching the program, the clinic reported a 50% reduction in hospital readmissions for heart failure patients. Not only did they improve the quality of life for the patients, but this process also lowered costs for both the clinic and the healthcare system. More importantly, it showed that even small clinics with limited resources can successfully implement RPM with the right tools and partnerships.